Good morning. My name is Hannah Lantos, and I'm here to present findings from the first phase of qualitative data of the WAVE study. Today's presentation is entitled Vacant Homes, Overcrowdedness, and Trash, How Youth Perceive Their Communities. And this was first presented for the PFRH Research Day. So a little bit of background on WAVE. The WAVE study is the Well-Being of Adolescents in Vulnerable Environment study. There are sites in Baltimore, Johannesburg, Shanghai, New Delhi, and Ibadan. There's also actually a site in Rio, but these data are the qualitative data, and we did not have Rio data. The participants in the study were ages 15 to 19, living in specific marginalized communities in each of these 5 cities, and the study was conducted specifically to explore the perceived health challenges and the factors that were thought to influence adolescent health. The preliminary analyses revealed that one of the most dominant themes across the sites was the perceived influence of the physical environment on health, and this presentation goes into a bit more depth on that. What is the impact of the built environment on adolescent health? The objectives of the analysis today are to describe how youth perceive their physical environment and in their community and how it impacts their health, and to compare these perceptions across the 5 sites. So what is the built environment? Historically, public health was developed to respond to unhealthy environments. We think of public health as starting to control water and airborne infectious disease. We see sewer systems and urban health developing as the beginnings of public health. But today, we don't really see that connection to the built environment in the public health discourse. We see that public health has moved towards vaccines or smoking, non-communicable diseases. And really, when we see the built environment in the literature, we see discussions of walkability, exercise, BMI, access to healthy foods, green space, occasionally alcohol, and sometimes mental health. This is where built environment really comes up, and it's very explicitly connected to conversations around obesity, and not much more. So how are people measuring this built environment in these studies? There are new indices that are being developed that combine counts and types of structures, how the population is distributed in the areas where there are big buildings and small buildings, vacant homes, safety and access to resources, as well as the existence of support structures. In this paper, we're hoping to move some of the conversation around what the built environment is away from simply walkability and more to these new indices and compare how adolescents look at them. So what's the point? Why are we doing this? There's an ongoing debate between the importance of people and places for health. There's limited studies among adolescents that focus, and those that exist focus on physical environment and BMI, while at the same time, globally, there's increased urban migration. So we see huge global metropolises that have majorities of their populations with young people living in them. And it's very unclear about how this built environment may contribute to an increasing urban penalty. So we need to understand what themes hold across these sites. So what did we do? We collected data for this study both about adolescents and with adolescents. The data about adolescents was collected by walking and mapping areas in each of these 5 sites. In East Baltimore, this was an area clearly defined from North Avenue in the north to Orleans in the south, Edison Highway in the east, and Greenmount in the west. We also spoke to approximately 20 key informants in each of the sites. These were often directors of youth organizations, occasionally providers, who worked with youth on a regular basis and could give us some insight into adolescent health in these communities. We also collected data with adolescents. With adolescents, we used 4 different methodologies. The first was a photo voice project. The photo voice trained youth to take pictures in their communities and then to have focused discussions about what the pictures were about and what the captions the youth would give the pictures. Some of the pictures are later on in this presentation. The second was a community mapping activity. The youth were given a map of the community and asked to to point out specific places, including places where they went to school, where they lived, where they felt safe, etc. The third was focus group discussions. These focus groups were conducted to identify needs as well as resources that existed in the community. And the final method was that in each site we conducted in-depth interviews with adolescents to understand a little bit more about their personal perspectives and experiences. We, again, conducted an analysis across all 5 sites. The interviews were recorded, transcribed, and translated. The transcripts were then imported into Atlas TI for analysis, and the initial code list was tested across all sites, with feedback being reincorporated into a final code list. The current analysis, we then developed matrices of these codes that related specifically to the built environment and how health was related to the built environment. These codes were created to focus on how the built environment influenced health. So the findings. The built environment was characterized by 4 main themes. Across all 5 sites, there were comments on dirt and pollution, the prevalence of trash in the neighborhoods. There were also comments on safety and experiences of violence. Recreational spaces, or more specifically, the lack of recreational spaces was common across the sites. And finally, infrastructure, or the lack of infrastructure or failing infrastructure. In Baltimore, infrastructure often had to do with vacant homes, while as in sites in the more developing world, this often had to do with access to resources like electricity or running water. These 4 themes were connected to 4 specific health outcomes. The youth spoke about unsafe sexual practices that happened in vacant homes or because they were bored and didn't have activities. They spoke about infectious disease related to the dirt and pollution, as well as because of the lack of infrastructure, specifically water, for example. They spoke about violence and experiences of violence and fears that violence would occur. And they spoke about drug use and access, because drug dealers were in the neighborhoods or storing their stash in the vacant homes, or because there was nothing else to do for fun. So a little bit more about the specifics. Here we see a quote from a key informant in Delhi that really elucidates some of the comments on dirt and pollution. She said, "There's so much dirt here and smell keeps coming from everywhere. The dirty water is found lying on the roads. The dirt is spread everywhere. The drains are full of filth. If they clean the drains after 2 or 4 months, the garbage is found lying there for many days. The atmosphere over here is very bad, and because of this dirt, it affects badly on the health, and the diseases also spread. There's no place available for playing." Here we see a picture from a youth in Baltimore. As you can see, it's trash in an alley, and the caption that this young woman gave the photo was, "In order to have a healthy community, you have to have neighbors who are willing to do something about it." Here's another picture of the trash. This one is from a young man in Baden. The caption given to this photo was, "People living around this very dirty environment may contact diseases, and they can't have good, clean, fresh air to breathe." The next theme that came up was safety. Across all 5 sites, youth spoke about not feeling safe in their neighborhoods or communities, and occasionally even in their homes. In Johannesburg, this is a quote from a young woman where you can see that she speaks about having security guards in her complex because there were people screaming about being beaten up at night. But even when the security guards were changed, she still didn't feel safe in her complex. The second quote is from a youth in Baltimore, and we see that this young woman speaks about, or 2 young women speak about how people run into their houses, but even in their houses they get shot. And the second young woman says, "There isn't anywhere safe to be." The third theme that came up was the lack of recreational spaces. In Shanghai, this is 2 quotes from 2 young people in Shanghai. In Shanghai, many of the youth were migrant youth who traditionally have less access to some of the more state-run resources because they don't live where they're from and therefore don't have IDs. The first young woman says, there are no sports equipments, no facilities, there's no place to play badminton. The basketball court does not have baskets. A lot of young people don't have a place to play. The second young woman says, for girls like us, if there are blocks of lawn to be laid down on, reading with our pals with music surrounded, it would be very well. But the problems are, first, there is no person to be with, and second, there is no such place. In Baltimore, we see a much more explicit connection to some sexual and reproductive health outcomes. We have a young woman who says, we don't interact with each other enough. Every time you turn around, you're standing in a guy's face or there's a guy you're messing with. So I think there needs to be more activities for women than for us to just go to school, come home, and lay on our bed. There's no activities for us, and it causes us to reproduce a lot. They don't understand that. The final theme was infrastructure, and as I said before, in some of the less developed sites, this often had to do with a lack of electricity or clean water. In Ibadan here, we see 3 young women, 1 male, 2 women, speaking about the neighborhood they live in. The first one talks about how there's no electricity or roads. The second one speaks about how there's a lack of piped water. And the third one talks about the area being crowded and overpopulated. In Baltimore, this often had to do with the vast number of vacant homes in the area. So this is a conversation between several youth, and they say, but they can't fix up the houses if the drug boys in there keeping stash and stuff. Yeah, that's why they board them up. When people move in, they board up the houses now, and nobody can break in. Every time they board it up, it's getting unboarded, like the house on the corner where I live. It's going to be an apartment now. Every time they put a glass window up there, 3 days later, it's busted open. This is another photo from a Baltimore participant of a vacant home. The caption given to this photo is, the inside of a vacant house is more than a scrap heap, it's a horror. So what do we do with this information? We see from this data that the health of adolescents is strongly affected by the built environment that surrounds them, but not necessarily in the ways that the current literature emphasizes. Most notably, even though the current literature tends to focus on aspects of the built environment that affect obesity, the ability to walk around a neighborhood, access to healthy food, green space, occasionally safety or mental health. These adolescents don't mention obesity once, although they do mention some of the other things such as green space or safety. A better understanding of this relationship between the built environment and health fits into the social determinants literature and needs more exploration. There's space for public health and urban planning practitioners to work together in this area to better understand whether or not obesity is the best focus or whether or not many of these things lead to obesity but would actually affect obesity if we dealt with them individually. So thank you. Thanks to all of our youth that participated in Phase 1, to all of our key informants, to the WAVE team, to Kristen Murray, who's been helping me with this presentation and paper, and also to all my co-authors from the other WAVE sites. And here are some references that were noted in the presentation.